So this is my collateral knee taping. I'm beginning with my power flex bases. So you do superior bases to start. For my subject, I did 3 on top, and you do bases below the knee. And the reason why you do these bases is to catch the tensoblast. So base 2, and then base 3. So once again, this is done with power flex, and now I'm grabbing my tensoplast to begin the actual taping. I palpate around the patella, and in this taping, angles are everything. So I'm adjusting to see where I want my angles to hit. And I am about to base off with the tensoplast. So I'm checking, there we go, base there. Once again, hitting that border of the patella, basing at the bottom. And so I will do 2 superior strips, 2 strips to hit the superior surface of the patella and 2 strips to hit the inferior surfaces of the patella. So I go around for the base. That finishes our superior pieces. So now I'm going to begin my inferior pieces. So base, up, and I ran out of tensoplast, so we're just gonna start over there. So I pull the tensoplast, it hits that inferior border, wrap it around, make sure it's nice and sturdy. And this will be my last inferior piece. So that is the last, or no, we are not finished with tensoplast. Next, I'll be covering my windows on the medial and lateral aspects of the knee. So you can't see it as well on the lateral aspects. You can see on the medial aspect that I'm about to hit. There are windows on the side of the thigh, and I need to close those. So I'm gonna lay those strips. So I'm cutting up my last piece and laying it down, making sure it's nice and smooth. Then I'm going to grab my power flex to close off the bases, or to act as my final bases, covering that tensoplast that I used to cover the lateral and medial aspects. And then I finish with my inferior bases. And that is it for the collateral taping. And now I'm beginning my extension tape. Once again, my subject is on a bolster. I am basing off with elasticon. So I did 1 base. I'm now beginning the 2nd base. So very much like the collateral taping, you're going to base below the knee as well. So I wrap it around the subject and trim. Then I'm going to begin the extension tape itself. So this is a fanning pattern. So I did 1 strip down the midline of the femur, and now I'm adjusting my 2nd strip, which crosses over that midline, making sure we're hitting that superior inferior base. And now this will, since my subject is smaller and I used 3-inch tensoplast, my fan is kind of small. This is subject to the size of the patient. And now I am basing off once again with elasticon to close off, make sure that tensoplast stays attached to the bases. It's a very stubborn tape, as you can see. So here we're doing our superior, closing off our superior base. And we're finishing that up. And here's a better view of that taping. So here is my patellar band taping using pre-wrap, wrapping it around the subject's calf a few times. Then I'm going to feel for that patellar tendon, and I'm going to roll that PowerFlex up until it hits the tendon. And there it is. So here's a knee compression wrap. So I begin at the calf. I'm doing a herringbone pattern, going to cover the knee using a double ace wrap and hitting the thigh. And I ask my subject to hold the wrap while I use PowerFlex to close it off. And this is my knee compression wrap. So here is my hip pointer wrap. So we're using a Tupperware to imitate the orthoplast that you would typically use in an athletic training setting. And I palpated for the ASIS, the iliac crest, to figure out where I wanted that bolster. I go below and above, making sure it is secure. And much like the other tapings, I'm going to use PowerFlex to seal it off. So hitting those spots where the ace wrap could slip. Make sure it's nice and secure on my subject. So here's my thigh compression wrap. I'm using an ace wrap for this. Beginning above the knee on the distal aspect of the thigh. I'm doing a herringbone pattern, as you can see by my angling up and down. I ask my subject to roll up their shorts just a little bit. So that herringbone pattern up the thigh, providing that compression. I finish off, and I, much like my other tapings, am basing off with PowerFlex to make sure that ace wrap stays nice and secure when they are in motion. And here is my hip flexor taping. So I'm starting at the thigh for my base. And once I get that angle pretty deep in, I'm going to go around the ASIS, feel for that, base off once again at the thigh, and I'm going to begin my second wrap around the hip. And you'll see me working on my angles because I want to make sure there's no overlap. Again, this needs to be a functional taping. So then I, like all the other tapings, base off with PowerFlex, and ideally the patient wouldn't have shorts on underneath, but in this situation, it's what needs to happen. So here is my taping for the patellofemoral joint, which is called the McConnell taping. I just measured my coverall over the patella. I'm cutting that measurement in 2 strips. So this coverall, I'm pulling lateral to medial. I just palpated those edges right there to make sure I hit them. So it's important with this taping to pull. So I'm pulling it nice and tight, making sure I hit those edges. Then once again, my last strip of coverall, I'm going to hit the inferior aspect that I did earlier. So now I'm pulling out my loco tape, and instead of pulling lateral to medial, I'm going to pull medial to lateral. So I get that nice pull just a little bit. Then this will be my last strip of loco tape. Once again, pulling it medial to lateral over that